Welcome to Podsdale, brought to you by the City of Scottsdale. Join us to explore the stories that make our city a world-class community.
And I'm Greer Albaugh. Today, we're diving into a topic that affects us all, mental health. May is Mental Health Awareness Month, and we want to take a moment to talk about how the City of Scottsdale is supporting both its staff and community when it comes to mental well-being.
Mental health is such an important part of overall health, and it's something we all need to prioritize. Scottsdale has a variety of programs and resources in place to ensure that residents and city employees alike have access to the support they need. From mental health education to counseling services, the city is committed to creating a culture of care and awareness.
That's right, Jada. Whether it's through youth and family services programs, collaborations with schools, or specialized support for city staff, Scottsdale is working hard to ensure that everyone has the resources they need to thrive.
In this episode, we'll be hearing from Kristine Hahn-McDonald, the Human Services Manager for the city, about how Scottsdale addresses mental health challenges, especially for youth and families, and how residents can get involved in these efforts.
We'll also explore ways the city is tackling common mental health misconceptions, offering educational programs, and ensuring that resources are accessible for everyone.
So stick around as we take a closer look at how Scottsdale is supporting mental health for both staff and the community, because mental health matters for us all.
Kristine, thanks for being on today.
Thank you so much. I'm so happy to be here.
Before we get into everything, can you tell us a little bit more about your role with the City of Scottsdale?
Yes, I have had the lovely pleasure of working for the city for the past 25 years in human services. I've held many different positions, starting off at like the senior centers to housing, and now I've spent the last 5 years at Youth and Family Services Behavioral Health. Gosh, I love being there. I get to offer a wide variety of programs to adolescents and adults that come through our office. We are a licensed facility through the Arizona Department of Health. So this offers us the opportunity to be able to offer programs that are specifically related to counseling, court-ordered services, as well as providing prevention and education to the community. So I get to do a wide variety of services and programs that meet a lot of different people's needs.
How did you fall into this line of work?
It was interesting because I'm a social worker. I also went early on in my career and got my licensure. So I'm a licensed clinician. I'm a licensed clinical social worker, and that's through the Arizona Board of Behavioral Health. A few years ago, the city decided that we wanted to offer more services out of Youth and Family Services. We wanted to assist the court with some of their needs, with some of those individuals who were struggling with the barriers of court-ordered programs where they were needing to get help with their DUI, needing to comply with anger management programs. And so it was best to try to keep that in-house, offer the services through the city. And so with that, in order to be able to be licensed through the state, you have to have a clinical licensed person to do that. And so because I'm one of just a few, I don't know that there's really too many people in the city who have a licensure with the state. So it was offered to me, and it's really been just a great opportunity career-wise. And it's also, obviously a passion for me as well.
That's awesome.
What does mental health awareness mean to you personally?
So I thought about this, and I think the importance of mental health is that it affects all of us. Mm-hmm. I think, especially when we're in human services, we think about people's needs, and we think about housing, and we think about employment. When any of those issues are compromised, if we're looking for a job and we can't find a job, how does that affect our self-esteem? How does it affect our confidence?
Right.
And so a lot of times, some of the referrals that we get at our office are from the Career Center staff saying, "Can you help this young lady? She's really struggling. She's so nervous about an interview, going to an interview and being able to answer questions appropriately." And so I think for me, going into the field of social work and working directly with people on a therapeutic level, I just have a lot of empathy for those individuals. I really want to see them move past these barriers. And so that's much of what the work we do at Youth and Family is getting people through difficult times, finding that light at the end of the tunnel.
And can you talk a little bit more about how Scottsdale supports youth and family through these services?
So one of the main things that we do and that we really enjoy doing is we connect a lot with the Scottsdale high schools and schools. So we do a lot of preventative efforts. So for instance, for the last couple months in March, we celebrated National Drug and Alcohol Facts Week. We did tabling events at each of the high schools, my staff, and spent some time with the youth talking about issues related to substance use and mental health. We know that Generally, people who are starting to use substances might start to fall into the area of having habit-forming behaviors or addictions. And so working with those students on trying to prevent them from ever going in that direction. Students are often brought into situations where they're wanting to test their limits. They're wanting to see what things are like. And so what we're trying to do is educate the students on what happens when you start to vape and use nicotine, and how that vaping nicotine could then lead to vaping marijuana. And so we want to teach how that affects our brain. It's really important to talk about the brain. We want to talk about how that affects our mental health, the way we view things.
Totally.
So those kinds of things are really important for us. In April, we did an event at the Boys and Girls Club where we went out and met with their teens about tobacco. It's called Take Back Tobacco. So focusing on nicotine. And so we actually have a substance use youth coalition. Kelly Van Wave, one of my staff members, works with that group, and they went out as a coalition and taught the kids about the uses of nicotine and how bad that is.
That's really cool.
Yeah, they actually had a really great time. They
Yeah,
played a
I bet.
game, and the kids enjoyed learning. And if you can make something fun about something that people are testing or learning about and plant some seeds, that's ideally what we're trying to do with their youth and family, is prevention and education surrounding these topics.
Right.
So you mentioned vaping and prevention. Is that go hand in hand with a lot of the challenges that you're seeing most often in our youth?
Yes. Yes. What I think we're most concerned about is that these vaping and uses of substances, but specifically vaping, that it's starting a lot younger. So we're finding that, and even in my office, we're starting to change a little bit of our programs and focusing more on some of the younger ones to touch on those beginning thoughts and thoughts about using versus older kids who may have, we don't want the older ones to be teaching the younger ones. So we're starting to kind of change our programs so that we can really hit home with the younger ones and stop it before it gets worse. Stop it before it does turn into marijuana use. Because what we're finding is that students are vaping, and then they're vaping more often throughout the day. And then they're then going into vaping marijuana. So if they start at age 12, 13, by like 16 to 18, it's so habitual that now they're entering into situations where they're having psychotic episodes, and our behavioral health hospitals are slammed with youth in the waiting room trying to get help because they're addicted to marijuana use and are using multiple times a day.
It sounds like you're doing a lot of outreach with schools. Is there any specific programming or things that you've done that are really impactful to you, or do you have any stories that you can pinpoint that really stand out to you?
What we need to recognize about youth is specifically, let's say it starts out recreationally, or we're testing the limits, right? Because that's what we're going to do. That's what adolescents are going to do. But then when it becomes a habitual situation, what we're finding is that the teens are actually saying, I know this is a problem. I don't know how to fix it. I don't know what to do. And so our counselors are having these conversations, these real conversations where the students are feeling low self-esteem because they're engaging these behaviors that just don't feel good. They know it's affecting them. We also have the major issue with social media.
Yeah.
And so, when we talk about the brain, we're talking about dopamine and dopamine hits that are happening constantly, nonstop. So we've got addictive behaviors related to vaping and the constant use of a device like that, as well as constant hits from social media. And so let's think about our brain and how impactful that can be. And we really need to slow all of that down. And so by doing that, we're supporting our youth. By having them come into our office, we're finding that one-on-one used to be we have our students go through group workshops, which is great. It's lovely. Students love participating in a social level. But we're also finding that students need one-on-one time with our counselors to talk about this individually, and then having some of those aha moments that say, that's right. I guess I need to look at my behaviors, look at the way I can change this habit. So we help them find those tools to do that.
Right. And are there common misconceptions about mental health that you guys are working to dispel or destigmatize?
I think overall regarding anybody, not just adolescents, I think as a whole when it comes to mental health awareness and for this month, the one thing we really everybody needs to understand is mental health and taking care of mental health is just like if we went to the doctor and we found out we had diabetes, you have to take care of yourself.
Totally.
And if you don't do those things to take care of yourself, you're going to have distorted thinking, faulty thinking. People will pick up on that energy from you in your workspace. And so mental health awareness is about recognizing those things, those thoughts, those behaviors that we engage in that are not helpful to us, that are getting in the way of progressing and having self, growth. And I think the first thing we need to do is recognize that it's not a weakness, that it's a way to become stronger. It takes courage to ask for help.
Totally.
So I think that's one thing I think is really important, is that we recognize seeking supportive services is a positive thing. I think also it's really important to note in the workspace or amongst friends, there's an organization called No Kid in the Corner. And I don't know if you guys are familiar with them.
Mm-hmm.
So I participate in a coalition called Mental Health Matters, Arizona. So in September, we offer a huge conference specifically related to mental health issues, mostly with adolescents. And we touch on things like mental health, eating disorders, and substance use. But who derived that, who is really behind all of this is a woman who started the program No Kid in the Corner. And it's as a result of her son taking his life. And so she is bound and determined to help others recognize when you say the word no kid in the corner, what she means is when you're at school, or let's say you're in the workplace and you see someone visibly struggling, they're isolating, they may not be talking to anyone, maybe having some emotional meltdowns or just not engaged, to ask them how they're doing. We're so caught up in our phones, and we're so caught up in like sending text messages, or we're right down the hallway, but we send a Teams chat meeting or Teams chat asking questions. It's important for us to engage and ask one another physically, look at one another. How are you doing? I noticed this or that about you. Sure you're okay? I recently listened to a podcast myself that said how significant that is, or even personal touch.
Totally.
Have you ever experienced a time where someone gave you a hug and you're like, that felt really good? Like, probably because I haven't been hugged in a while, So those are the things I think they're just really simple things, but they're so impactful.
Right. And I think in this day and age, a lot of that just gets swept under the rug. We're just so busy in our day-to-day lives. Everything has just gotten so crazy. It's just like the last thing on your mind.
Exactly.
And that's just, it can't be. It's
right.
Human connection is so important, and it affects everyone. If you're not getting what you need, it's not only going to affect your mental health, but it eventually will affect your physical health. And so I think it's important that we address that when we can.
Yeah, I think too, sometimes we think what is shown on the outside. I'll never forget, I used to run some parent education classes, and I worked with another counselor, and she always appeared so happy. And I was almost kind of jealous of like her persona of just looking like she had everything together and just happy and just, and I thought, gosh, she's, got a great attitude. I later found out that she actually did try to take her life, and she wasn't her headspace wasn't in a good place. And so we can't always know what's going on with one another. We can't assume that life at home isn't a challenge. And so I think that assumptions and everything that's behind mental health awareness is related to those types of things, taking care of one another and not automatically thinking, oh, they're mad at me. This
Right.
could be something personal that they're dealing with,
Totally. You mentioned a second ago running some sort of parent course. Is there any way for parents or guardians to get involved in supporting youth when it comes to mental health?
We don't have anything specifically related to parents working with youth. Right now, my office is really starting to work really closely with the Scottsdale Unified School District to see how we can incorporate some of that, because we know parenting is difficult, right?
Mm-hmm.
And we know parents generally want to support their specifically adolescents. Let's be real. That's the challenging times. Well, not always. I mean, it's hard being a young parent too. I think I want to do a little shout out to our Family Resource Center at Paiute. They offer a lot of programs for those young moms who are new to parenting that, struggle them because we want to be a great mom, but gosh, I wasn't ready for all this. They do some great programs for those moms and a lot of support groups and things like that. So in Human Services, we do offer programs when it comes to senior services, when we're talking about all populations, each of our centers in human services can address some of those behavioral health needs. And so if ever any of those things pop up, they can either find something in-house at those community centers, or they will reach out to our office for supportive services.
I know that you work closely with the Scottsdale Mayor's Youth Council.
Yeah.
Can you talk a little bit more on how that program empowers youth to engage with mental health topics or just community in general?
Yeah, the Mayor's Youth Council, first of all, we've got a great group of kids. And so we will touch on behavioral health and mental health. We actually, each year we pick a topic. This year was life skills. And so again, back to mental health, everything related to life skills, being able to move on, leave your home from your parents. It's probably, I think for you guys, even being young, I know you probably experienced that transition of I'm leaving my mom. It's scary. It's really hard. I think that for me as a therapist, I love that population, that young adult population, because it's so difficult, but it's a great time to learn about yourself. But you gotta get through those difficult times. And so we did life skills for our youth town hall this year and focused on, nutrition. How are we going to eat better when we're on our own? Mom and dad always make sure that the food's there. College and career readiness. So again, that transition of what it's like to live on your own, manage a budget. So we did financial literacy. So that was the theme for this year. A few years ago, we did focus on mental health, and it was more so specific to learning how to deal with our mental health and how we can cope through those things. And so one of the things we talked about was meditation. Mindfulness was the main topic, and learning those skills surrounding mindfulness. It's interesting. Each year we pick a new topic. It may not always be specifically related to behavioral health or mental health, but somehow we find that way. Even we did a topic on sustainability, and the speaker that we had spoke to us about being sustainable in their environment related to all these things, but also socially, like staying connected to people, how important it is to find community groups, to feel a part of something. We know that loneliness has been an issue for people. And so finding your people, finding your connections, whether it's faith-based, feeling a part of a team, we know how team sports are super effective. And so finding those avenues to feeling a part of something is always helpful. Yeah. And so the youth have focused on that as well.
Yeah, I definitely could have benefited from some of those courses prior to going to college. I feel like college was a very pivotal time for me where I just really, you're right, it's the first time you're alone. It's the first time you're without your parents, and you really just have to kind of figure everything out. And I think if I had had a little bit more support in that area, it would have been really helpful. So I think that's a really cool program that you guys offer to people.
Thank you. Yeah. It's great. We get to, I get to work with some great kids. Kelly, like I said, she's got the Substance Youth Coalition. We're really looking to, if I can do another little plug, we want our group to be more diverse. So we're looking for anybody who wants to participate, who's interested in substance use and the prevention and education surrounding that. Specifically those that may be around others that use and saying, I don't like the way they behave when they're using, or I want them to get help, or how can we stop them from it becoming an addiction? Those groups and our coalition are trying to really focus on that.
And are there any upcoming events or campaigns for the month of May that you'd like people to know about?
Actually, yes. I'm glad you mentioned that. We have National Prevention Week that's going to be May 11th through the 17th. So that's in combination with mental health awareness. And so I've got a staff member who's going to be out in the community each day that week, focusing on, I guess, the theme for this year is called A Celebration of Possibility. And so I think the theme really relates to the fact that anything's possible. So do not put those barriers in front of you that says, I don't know how to seek help, that we're out there, we're going to help you find it, that there's possible ways to find help specific to, like I said, employment, learning, interviewing skills, how we can help you get through the struggle with going through an interview. And so we'll talk about that. We'll talk about substance use because we know that that's really a difficult thing. I'll never forget, one of our police crisis team members told me that one of the things that they have found with individuals who've tried to take their life, suicide, and they've gone on these calls for suicide, was generally a lot of it's financial. That's a top issue, but also somebody who's gotten a DUI. I don't know if any of you have ever had a friend or anything. The impact of the guilt the financial, the effects of it is so massive that they found that some of the calls that they go on are somebody who's recently gotten a DUI and has to deal with the consequences and the emotions behind that. And so for me and my staff, we really, although there's an issue related to a criminal violation, we also want people to recognize that they can feel safe and that we're going to help them find the resource and tools to get through this difficult time in their life.
That's really cool. Before this role, I previously worked at the court, and I was face-to-face with a lot of the customers who had gone through or been affected by some sort of law that they had broken. And I had no idea that those resources were available in the city. Like, we had Dee and someone else, I can't remember his name off the top of my head.
Yeah.
Matthew. Yes, Dee and Matthew. They're the most compassionate people, and it's just really cool that we offer those services so close to where everything happens. It's just something I didn't realize we had before, and it's really cool.
Yeah, it's genius, actually. Whoever thought of it to have human services in the court. You can imagine emotionally how you're feeling when you have to go sit in front of a judge. I can't tell you how many times the staff, Dee, Matthew, Deanna, when somebody walks into that space, we always talk about how someone makes you feel, like the importance of how someone makes you feel. You walk in and you recently had to deal with the reality of like your mistake, right? And how terrible you felt. And then they can walk in and have somebody who's non-judgmental soften the blow with what they have to, take on in terms of financial issues and going through a screening and talking about your alcohol use. That's all, you're in a vulnerable position. And so we try to help to make that transition easier.
Totally. And I think it does help because I've gotten comments when I worked there on how accessible everything was and how easy it was to get that connection. And I just don't think I've experienced something like that anywhere else I've ever worked. So it's definitely making an impact.
Thank you. Yeah.
Before we head out, what are some common misconceptions about mental health that you are working to dispel?
I think people think when it comes to mental health or when they have to seek counseling, I think I feel crazy, or, that word of like crazy, or they need help. Even in the courtroom, or, related to some people, they're crazy. They're crazy. I don't know what to say. They're crazy. That's not, when you need help with your mental health, you're not crazy.
Yeah.
You guys had asked me a question. I didn't probably address it completely when it came to even personally, my mental health. We have to, as therapists and even my staff, and anybody in human services really in that helping field need to take care of themselves. And so we need to dispel the idea that feeling like you should be able to take care of yourself. I seek peer consultations from actually even human service staff from other cities to talk about some of the challenges I might be having. If I'm not healthy and I'm not engaging in healthy behaviors, then I'm not going to be good for my staff. I'm not going to be able to help them, and I'm not going to be able to help the clients we work with. And so it's important to recognize how we need to take care of ourselves on so many different levels, professionally and personally.
I completely agree.
Yeah. Well, thank you so much for joining us on this episode about mental health awareness.
You're welcome. Yes. I'm glad to be here. And if there's ever if anybody's looking for resources, human services as a whole, we're here to help. My office specifically, I don't think our mentality in human services in general is when someone calls and asks for help, we're going to try to find you the resources you need, whether it's in-house or an agency. One of the last plugs I'll have is the conference that we are having with in September during National Suicide Prevention Month is with Mental Health Matters. It was what I referenced earlier. And it's a great opportunity to come and learn from a variety of different professionals in the field. So if you're looking for additional support, please call our office. We do really try to get some good prevention and education out there surrounding this topic.
Awesome. Great. Thank you so much for coming on today, Kristine. We really appreciate it.
Thank you. And thank you for having me.
Of course.
That's all for this episode of Podsdale. If you enjoyed listening, be sure to subscribe. You can find us on YouTube or in your favorite podcast app. Share episode ideas and provide your feedback by emailing communications@scottsdaleaz.gov. Thanks for listening.